Good evening, everybody. Normally, I wouldn't have this Facebook Live so soon after the last one, but given the fact that we had a significant milestone that we reached with coronavirus, I think it'll be important to kind of have a refresher course of what to do about coronavirus. As you know, we reached 200,000 new cases in one day, and death rate in the U.S. is now close to 260,000 and 1 year, and I think that is very significant. Just imagine we have some sort of war or other kind of conflicts going on, and in 1 year we have that many Americans die. That would be a significant revolution, and yet nothing really seems to happen. And we're still in the midst of that, even close to a year later. I think the important thing to remember is that as we get dragged on with this pandemic, a lot of us are facing a lot of COVID fatigue. We're just getting tired dealing with that. We've become more complacent, we've become more numb with the information's available and with the new statistics that come out. And I think it's really important to kind of pay attention and be vigilant. You cannot be too careful in this day and age with coronavirus, and it's extremely important to be prepared for that, especially with the holidays coming up. And there's this kind of temptation to have gathering with friends and family as if nothing happened. Well, it is a big deal. Over close to 260,000 Americans already died this year, and I think it's important to remember that. So the question is, what can you do? Let me just kind of go through a standard situation for you. But a case in point, story today, we have this mom came down to Southern California to visit her daughter. And the next thing she knows, she came back to the office and she was having some dental work done. And she happened to know somebody in the dental office. Well, a few days later, guess what? The dental hygienist and the staff in the dental office was told that she tested positive because her daughter was sick and positive. And so now everybody was infected. The dentist has to close down his office for a number of days, and they have to go through a whole bunch of different cleaning procedures. And it is unnecessary because she took the trip down to Southern California. I think it's really important to highlight the importance of just stay where you are. And just keep the distance and not having extra interaction with people that are you normally not interacting with day to day to reduce the transmission of the COVID. Anyway, so what do you do to improve the odds of not getting coronavirus? Very standard thing you hear about, wearing your mask 6 feet apart. This is especially important when you start eating or drinking around people. When you start to take your mask down and then you drink some drink or you have some food, that is extremely important because then therefore no mask. So of course if you sneeze or if you're just talking, a lot of the droplet will be flying in the air and then it gets stuck into different parts of your clothing article, even your eyeball, even your skin, and then all of a sudden you can touch on that. Now the problem is some of us might not get infected because you might have a strong immune system. It might be stuck onto your clothing article or your face, your skin, your hair, and you don't even know that you have it, and you might not even be infected. But then when you come across another person, then all of a sudden then those droplets can get deposited into the weak immune people, and then all of a sudden they get infected, and that becomes a problem. So it's extremely important to pay attention when you actually let your mask down and then actually interact with other people. So extremely important when you actually put the mask down. Then make sure you are truly 6 feet or more apart. That way then you minimize any chances of transmission. Number 2 is, I think one thing that we don't have a lot of discussion in the coronavirus pandemic is how to boost our immune system. How do we strengthen our system, our body, so that we are better positioned in fighting with the enemies, and the enemies would be the coronavirus. And I think a lot of time we rely on, well, we don't have medication, we don't have vaccine yet, but what about us? Don't we all agree that the most sophisticated machine there is in the world right now is us, human being, and yet we keep relying on someone else's or some medication to help ourselves. Well, certainly that would be helpful, but I think it's really important to kind of rely on ourselves. And those of you who actually listen to me from the other talks, you realize that how to improve yourself. So for coronavirus, what are the bare minimum? What do I do? What I do is pretty simple. So number one, you want to take a regular multivitamin, keep your vitamins level nice and strong. I usually add the vitamin B complex plus C. The B complex is going to give you a lot of coenzyme so that you can absorb nutrients better. And then C is going to give you the collagen, which is one of the important building blocks for you to help to repair yourself. So if you have an injury, whether from coronavirus or you're just falling down, having extra vitamin C is going to be helpful. And then for coronavirus, most importantly is vitamin D. I know a lot of you might not hear this receptor called angiotensin 2 receptor, which is how coronavirus invades your body. And guess what? Vitamin D is going to help to fight that. And also the vitamin D also is going to help to strengthen your white blood cell as well. So extremely important, and many of us are low in vitamin D. I have to say in the course of the week, about 80-90% of my patients are actually low in vitamin D. The level is under like 30, which be considered low. You want it to be 40 to 50. So how do you get there? Instead of just taking a small amount like 2,000 unit or something like that, I would recommend take like 5,000 units twice a day. It sounds like a lot, but it's actually not. 5,000 unit is 125 microgram, and if you take those, it'll be of the equivalence of going to the sun about an hour and a half. So it's not a whole lot. Now, if you just want to be sure you're not overdosing yourself with vitamin D, pretty simple. Get a blood test, check your level of vitamin D, and as long as your level in about 40 to 50, you're okay. You just take a standard kind of supplemental amount. You don't have to give extra amount. But why don't you start with the 5,000 twice a day, get your blood test checked, and if you're not there, continue until you get to that level. A little extra zinc would be helpful, about 220 milligram once or twice a day. That would also help to fight the coronavirus a little bit easier, or boost your immune system. And then extra vitamin C, I think, is helpful. In fact, some of you might notice this is in the ICU, the intensive care unit, when people get septic shock, they actually get IV vitamin C. We're talking about 1,000 milligram IV every, so 6 to 8 hours or so, pretty high doses. And yet, when you barely get sick and you worry about getting sick, you actually don't get that. Why is that? Why don't we get it before we get so sick, so you go to the ICU? So if you're at the hospital or you can get the IV vitamin C, that would be helpful. But if you're just like a regular person living at home, you can just take extra vitamin C by just take a little extra amount of that. Now, if you take a little extra and your body don't need as much, you just kind of void it out. So it's not the end of the world if that's what you do. So that's the supplementation side. Number two is, how do you maintain a healthy body? Well, as incredible machine as we are, if we keep making it works all the time and we stress this out all the time, then sooner or later it's going to break down. So you need to rest it. You need to rest your body. How do you do that? So you need to rest time between your eating period. From my last Facebook Live, I recommend to finish your eating business by 7 p.m. and don't eat again 11 a.m. So that gives your body a little extra time to rest. And you don't have to, your body won't have to work so hard to digest food and to deal with all the extra chemical and hormones and other items that you have to expose yourself in the eating process. And then number two is that then that gives your body a chance to cleanse itself out, and I think that's really important. So I think that's really important to kind of make sure that you give yourself a little break, and that also including sleep. Sleep is giving yourself a little break. We talk about deep sleep, sleep where you actually rest well when you wake up, and that would be important. So you want at least 6 to 8, preferably 8 hours of good sleep, so then that way then you'll be able to again rest your body, rest your sophisticated machine in order for it to be able to deal with life adversity. Stress also causes a problem. We talk about how to deal with stress. If you constantly get stressed out all the time, your cortisol level is up, your other hormones are always up, then your sugar is going to be up. And again, sugar is a fuel of life. So when you have a lot of fuel into inflammatory responses like coronavirus or other kind of infection, then it's going to make it a lot worse. So that's why it's extremely important for you to keep it to the minimum. So don't get stressed out. It's not about what to do with the stress, it's how to deal with stress. One of the phrase that I used before is don't drink the poison. You might be surrounded by stress, you might come across situations stressful, but if you don't let it to dictate how you live your life, then you're going to be less stressed out. I think that's really important. And then the next thing is, well, if you work in an environment like I am, I know a lot of nurses working with me here on the Facebook call, and what if you get, how do you protect yourself? When you work in a more contaminated environment, could be the hospital, could be a busy restaurant or outside environment, first responders kind of situation, what I highly recommend is, well, guess what? Make sure you protect yourself. So what I would do, and this is what I've been doing for the last like 9+ months, is when I leave the house, I leave the house on the side gate, and I go do my work and wear the scrub. Before I go home, while I'm at work, I wear a gown, put the mask on, and before I go home, I change my scrub, so it's going to be a new scrub. And the minute I get home, I don't go through the main door. I go to the garage, take off all of my outside clothes, go straight to the restroom, bathroom, and shower at that point. So just shower everything off. And you might want to use salt water to gargle, so you clean the back of your throat, and also the nostril where some of these viruses might be hiding. And then you put a new pair of clothes on, so then that way, then when you're inside the house, you're not going to have a lot of contaminated possibility. And I've done that for the last 9 months. I do it every single day. And on the days I have to go back to the hospital and I have to go back to the home, guess what? I shower again. Well, by the way, those of you who know me, I do cold shower, doesn't matter what time it is. And so that will help to boost my immune system, but not all of you have to do that because you hadn't trained yourself to the cold therapy business, so of course you won't have to do that. But that will help to keep you healthy, boost your immune system up, and that will actually help you to fight off coronavirus. And then of course, then what if you actually catch coronavirus, then what? Well, different people have different scenario. If you're healthy, you have good immune system, you fight it off. You might get a little flu symptom a little bit for a day or two. You take your extra vitamins and supplement we talk about, you get better. That's great. You still want to keep away from other people so that you don't want to infect other people. But if you do get sick, I think the important thing is to be prepared for that. So just hypothetically, you get sick, what do? Number one, you want to be prepared for that. What is the number one problem to deal with coronavirus? It's going to actually consume your pulmonary function a lot of time, or your GI function. So for the pulmonary function, you want to be sure that you maximize your air exchange capacity. So how do you know you're doing that? Really simple. Make sure you get one of those pulse oximeter. Make sure it's above like 93% if you can. And the number two is do a breathing exercise. Now don't wait until you get sick and you can't breathe to do that exercise, because it's going to be really hard to do. So you want to expand every single part of your lung before you get sick, so then that way that if you ever need that extra capacity, it is ready to go. So I usually put one hand on my heart, one hand on my stomach, take a deep breath in, and then you feel both the chest raise up and the stomach expands, and that would be a nice deep breath. It's like 120% of your regular day-to-day breathing, and you suck it all the way in, and then you blow it out. And you do that 15 times, and you do those kind of repetition about 4 to 5 times or more a day. All that does is going to help to expand all parts of your pulmonary function, your lungs, so that if some lower part of the lungs get basically inflamed and get flooded with some phlegm, then all of a sudden you can still use the spare parts of your lung to do air exchange, and that's important. Positional is important. So if you get sick and you have to be in a certain position, find the best positions for you. Because what happened is that when you lay in certain position, then the amount of phlegm or fluid in your lung is going to be less problematic for air exchange. So you need to find that position. So whether you sleep on the side, face down, on the couch, on recliner, doesn't matter. Try a different position. Number 3, you want to minimize the amount of oxygen use. That's the number one problem people don't talk about. So when you have coronavirus attack and you have problem breathing or even have some diarrhea, maybe dehydration, the last thing you want to do is overutilize the amount of energy you have. What is it? Well, just talking, just doing stuff, walking around. Well, guess what? Whenever you do that, all of the extra blood, oxygen, and nutrient have to go to your muscles. Well, you don't want to do that. You want to save all of that for essential organs internally. So I told all of my patients, just be a total couch potato. Park yourself down. Don't walk around too much. Don't run around too much. Don't do anything too much. Just the bare minimum. Why? You don't have extra blood flow to your to your muscles, to other parts of your body, and therefore more is available for your internal organs. Number 2, instead of talking on the phone with your friends and family and tell them about your symptom and how terrible it is and all that stuff, I told all of my patients, well, guess what? Just use texting only. No phone call, no talking. It takes so much more effort to talk, and you have to take a lot of air out of talking as well, when texting is going to be a whole lot less. And you can even cut and paste some of the responses from one family member to the next, so that way you don't have to repeat yourself all the time. So when you do texting, again, you conserve energy, conserve oxygenation, and then all of a sudden you have a little extra. When you actually get to the desperate time, extra amount of oxygen and reserve is extremely important. Now, if you have the GI symptom, sometimes you have coronavirus, causes a lot of inflammation, upset stomach, diarrhea, then the best bet is, besides all the typical supplement, I highly recommend to get yourself some charcoal capsule. Activated charcoal, basically just purified charcoal. It has very high surface area, and it's very good in terms of absorbing all the inflammatory cells, including dead viruses, so that you can hang on to it and pass it out. So then the amount of virus and the inflammation is going to be lessened in your GI system. Therefore, it lessens the severity of that. And I think that's important. Of course, fluid hydrations and all of that is extremely important as well. Throughout all of those times, you want to minimize the amount of carbohydrate intake, because sugar is the fuel of life. You don't want to put more fuel into the enemies that you're trying to fight. And I think that will help to significantly improve your odds of getting pregnant. So if any of you or family members get sick and you go to the ER, the hospital, they test you positive, they just send you home, no medication, no instruction, that's what I want you to do. Do your breathing exercise, get your supplement in place, and then be a couch potato. And just wait until your body gets a little bit better. Number 2, or my other favorite things to add at that point is emergency. Those packages have extra vitamin C in there, has a lot of extra antioxidant, extremely important. And then the last part is that you want to detox yourself, because when you actually have these inflammatory responses going on, just like other kind of inflammation, it's going to clog up your system, especially your kidney and your liver. So that's when you do that artichoke tea that we talked about. So get 2 big artichoke, cut in half, wash it well, put the biggest pot of water possible, boil it up for 1 hour, save every single drop of that fluid, I call the artichoke tea, into like a glass container, drink 2 glasses every single day, 1 in the morning, 1 in the afternoon. I literally have my patient who's actually in the step-down unit in the hospital to bring it into their isolation room to take that, because that will help to kind of clear out their liver, and that will help to improve their recovery time. So that's basically it, and then you continue with the supportive care, so then you get better. I think that's extremely important. Now, being careful is important as well. As you probably know, a lot of people who actually tested positive, they told that after 10 days without symptom, after 10 days positive and 3 days without symptom, they can just go back and do your regular stuff, interact with the rest of society, and by the way, you don't have to retest yourself. And I have big problem with that. Here we're dealing with a very high virulence kind of virus, and yet we just take the leap of faith that, well, you won't be infected after 10 days. Well, maybe you are. Maybe a small percentage that you are not, because you have a weak immune system and you tend to carry these viruses more. Some of them might not be in your pulmonary function. Maybe some of them are in your GI tract and they hadn't passed out of that. They're kind of hiding in there. So I think it's important to just reach out yourself just to be sure. And once you're negative, you can't go wrong. Testing used to be difficult to get, but nowadays testing is so easy and it's covered by many insurance. And even if you don't have insurance, it can be done for free too. So therefore, I think it's important to get that done. Once you get that negative test, it's a lot more reassuring than not, and I think it's very important. I said something earlier about increases chance of getting pregnant. I guess I didn't mean to say anything like that. I'm talking about coronavirus here, so I'm not wearing my OBGYN hat today, and therefore I'm not talking about pregnancy stuff. But of course, one of the reasons why the two kind of linked together in my head is literally about half an hour ago, I dealt with a patient who just recently pregnant, 36-week pregnant, who actually just tested positive, and she's getting very worried about that. So that's why I think in my mind the thoughts kind of cross a little bit. But anyway, so the bottom line is that very important for you to stay healthy and get the negative test. Insist on having a negative test before you go out and interact with live society, because it is going to be a lot safer. I know it's an extra step. I know that might not be necessary, but I think it's going to be the wise thing to do. Just like I said before, you can never be too careful, and I think it's important to not forget that. Now, friends and family get together. Do you really want to get together? I highly recommend all of you to take advantage of this year to just play it safe and stay home and just be with your immediate family who actually interact with you day in and day out, and just have a simple, quiet Thanksgiving. Why? Because of the fact that way you won't be spreading or increase the chances for virus to be spreading to other parts, other community, other subgroup in the society. Now, a lot of you might seem to have this feeling that, oh my God, you're going to be missing out on anything. Do you really think so? How many times that Christmas or Thanksgiving get together that afterward you complain about, oh my God, all the traveling, all the family drama that you had to deal with, how much hurt feeling one person have, another person, how if you go to one family for dinner and you didn't go to the other one on Thanksgiving, people is going to feel bad about it. There's so many level of stresses in your life, and this year you got none. You can just be home and be with your immediate family. It's really simple. We do really simple technique. It's good to slow down a little bit and focus on yourself, nurturing your soul, nurturing your spirit, so that way then you can be strong and deal with life, society, and adversity in life. I think it's really important not to forget that. So take advantage of that instead of trying so hard all the time. I think sometimes we try too hard. And I think that's the important message to remember. And then go out there and be safe, enjoy your life, do your exercise, go to explore the nature that you haven't done before. Go to the beach, walk there with a short on. You can really feel the cold water and really feel it. I guess today there's high surf advisory, so just be smart about it. Keep your eyes on the wave and make sure that you're not going to be swept away. But do that. Go hiking and doing outside kind of sport event. I think extremely helpful. Or just take a drive down Big Sur or something like that. And I think all of that is going to be very helpful. Today, just like a short kind of talk about kind of update. Don't let your guards down with COVID fatigue. So make sure you keep your guards up. You can never be too careful. Do all the supplement that we talked about. We'll post a lot of that on the website, on the Facebook, so that way then you'll be able to kind of link to that as well. And then you can really have a healthy life and behaviors without all of the extra concern and stress in your life. Now, if anyone of you have any additional question, we can just entertain that. So then we can just be a little more specific and then go from there. Since earlier there's a question about pregnancy, so pregnancy people with COVID, what do you do? The number one thing is similar to the rest of the body. The placenta is like a big filter to filter out some of the bad toxin coming from mom to baby. And so sometimes the coronavirus and the inflammation can clog the system. So all we have to do is test the baby real well, make sure your baby happy inside. Starting about 32, 36 weeks or so, make sure that baby is growing appropriately, the fluid is okay, the blood flow between mom and baby is okay. And then go from there and just be cognizant. I think that's really important. But for a pregnant patient especially, I insist that they should get negative testing after the initial positive. So usually what we do is that after about 10 to 14 days, we test the patient. If they positive still, then we still keep distant quarantine, still monitor them or even check the patient in a safe environment, but then retest again about 14 to 21 days later. It is best to wait it out. I know sometimes it takes a long time and it's kind of frustrating, but it is the safest thing to do. And by the way, I do that for my staff. My staff who tested negative, test positive, I make them test again and they weren't ready. I tell them that, well, just take some time, work from home or something like that, and then retest it again. I do lead by example, and I think it's important for all of us to do that in order to be sure that we all stay safe and healthy together. Because approaching 260,000 deaths in 1 year is absolutely unimaginable. And yet here we are at the end of 2020, and that's what we're facing with. And that's really sad. By the way, don't think that the vaccine is going to just help to just kind of wipe the coronavirus away. I think vaccine is helpful, and we'll see how it's going to be. But just like the vaccine for a flu vaccine, there's still people who get sick. There's going to be still people who actually can die from these kind of scenario. So sure, the magnitude is going to be significantly less once everything is out and study and learn and refine. But don't look at that as just the only thing. Maximize your immune system so that way then you are strong and healthy, and that way then you can be a lot more ready to deal with these infective process coming in. With that, I just wanted to thank you for having a conversation. Unless we have other questions or comment, we can entertain that, or you can just post it online, and that would be it. Thank you again, and I'd like to thank you for a short notification to my two producers, Diana Han and Grace Khieu, who actually helped me to put this together in short orders, but we just want to be sure it's important to have this update information to share with you all. And have a good night.